What's up, guys? I'm Sarah.
And I'm Haley.
And we're
the Device Girls. Our mission for our podcast is to inspire and empower,
educate, and learn all about the medical and healthcare industry as a whole.
So tune in, and we hope you enjoy this episode. Welcome back to the Device Girls. I'm Haley.
And I'm Sarah.
And we have a wonderful guest with us here today, Kelsey Stevenson. She is a dental hygienist based out of DFW. We're going to bring her on today and kind of talk about all things dental. Sarah and I are no experts on this at all. So we want to ask her all the questions and let you guys get to know her a bit. So
we're so excited she's here. Thank you so much for coming, Kelsey.
Should we cheers to that, ladies?
Back in Abilene.
Yeah. Cheers.
Got a Celsius. Here we go.
Okay. So Sarah, first kind of explain how you and Kelsey know each other besides growing up here together.
So Kelsey and I grew up together. We are both from Abilene, homegrown. So we kind of became pretty close in high school. Her junior year, my sophomore year in physics class. And I have loved watching Kelsey grow and her journey into her career. And we've stayed in touch. And I'm so glad that she's joined together with us today. But it's kind of a really funny story because Haley and I met unconventionally at MSC. But how Kelsey and Haley met was also a really weird experience. Why don't you share?
Yeah. So I never met Kelsey ever through
different
Sarah.
Friends.
Completely different
areas.
So we both ended up going on, it was a birthday trip in Cancun, and we were at a resort, and I think I was there already before you got there, right?
I think so.
Okay. And so I'm down by the pool. To be honest, I was already 4 drinks in at this point. And Kelsey and I are talking about medical sales, just having a good time. We're on vacation. And how did that happen? I was talking about medical sales college, I think.
Well, I had met all the girls besides you and one other.
Right.
And then whenever I said I'm from Abilene, you were like, oh my God,
my
friend Sarah.
Okay. I said my friend Sarah's from Abilene, and you're like, no way.
Yep. Small world.
So I'm mapping. And I get a FaceTime from Haley.
Yeah. She's
and it's Kelsey on Haley's phone. And I knew she's in Mexico. And I'm like,
wait a minute.
Is this a dream? I'm like, what is happening right now? How is this? Yeah. So small world.
Lots of margaritas when we sent you that FaceTime.
Yeah.
That was funny.
It looked like it was fun for sure.
That was lots of fun.
So, yeah.
But anyway, Kelsey, give us a little bit about, your background, who you are, what you do, that kind of thing.
Yeah. So I born and raised in Abilene, Texas. I went to Tarleton State under a marketing degree, actually. Hated it. It was boring to me. So I switched to actually nursing. So I was pre-nursing. And then one of my good friends from Abilene was a dental hygienist. And she was like, come shadow me. You're going to love it. I did. I loved it. Mm-hmm. Thank the Lord. Prereqs for nursing and dental hygiene were kind of the same. All your anatomies, physiology, micro. So I lucked out and applied to both at the same time, chose dental hygiene, and left Tarleton. I went to A&M College of Dentistry in Dallas, and then kind of stuck around the Metroplex, and I'm still there. So
that's awesome.
Yeah.
Talk to us a little bit about the schooling, what that program looked like.
The schooling. Okay. So to be a dental hygienist, you have to have 2 years of prereqs to apply. And then once you apply, it's 2 years in school. So when you're in dental hygiene school, you do your clinicals and all the fun stuff, but you also retake dental courses. Mm-hmm. So radiology more, I did more anatomy classes, head and neck anatomy more than body. I did a bachelor's program, whereas not all dental hygiene programs are a bachelor program. So I actually retook all of my prereq courses through A&M.
Oh my gosh.
Whereas the associate programs, you don't do that. So those are a little more lenient. But when you get out of school, it's the same.
Okay.
So we make the same. Nobody cares where you went. But I can teach in a clinic, whereas they can't. So.
Okay. Awesome. So what did the curriculum look like? How was that set up?
in school.
In school.
Oh boy. My first semester, it was all hard classes. So it was retaking my anatomies, retaking micro. I retook, we didn't do stats. What did we do? Pharmacology. That one was hard. Kicked my butt.
And this was like in the hygiene program?
In the hygiene program. Radiology. We did courses on anesthetic because they've been trying to pass that in Texas for hygienists to do. It didn't pass while I was there, so I took them for fun. And then once you start your second semester, you start seeing like partner work. It's like me and you, if we were partners, I would clean your teeth and vice versa. That's kind of scary. Yeah. Letting someone else work on you who's never worked on somebody's teeth. I guess before that we did work on like dummies, but it's just different. And it's weird being in someone's mouth.
Yeah.
And then the last semester, it was more, we had a few classes, but pretty much it was clinic like 8 to 5.
Okay.
Every day. So that's when we saw actual patients, those poor patients. It was good. It was good.
Poor patients.
They sacrificed their time for us to come in. I mean, it takes 3 hours, sometimes 6 hours to clean their teeth because everything we do is checked.
Yeah.
So if I dental chart, if I do anything, they double check it. So it takes forever.
Is that similar to like how like cosmetology, it's a reduced price for them to come in and get this
It's
treatment?
like $50 for a deep cleaning where normally you would pay like $1,000 at the practice.
Shoot. I would pay $50
but
for
they
that.
sacrifice their time for sure. And we're
accidents
newbies, so
happen?
they can tell we're nervous. They're like, is this girl know what she's doing?
Okay.
And,
that's funny. Oh my gosh.
but it was tough.
Yeah.
It was tough.
Yeah. That's
Hey,
exciting.
you
What
have to
was
go there
your,
somewhere.
how much time did you spend on a dummy before you started peer-to-peer type of?
Probably like 8 weeks.
8 weeks.
You learn how to use each instrument on a dummy, and then you kind of transfer that into an actual mouth.
Okay.
Yeah, probably 8 weeks.
You were good to
It's
go.
been a long time since then.
Yeah. No. It's okay. We totally understand. I know when we were doing our episode the other day, it was like, how long?
I think it was like
Let's walk through the MSc curriculum. Wait,
Yeah,
what exactly did we do? Yeah.
That
I
was
recall.
that was
2 years ago?
2016 for me. So yeah, it's been a
yeah.
hot minute.
Yeah.
Plus, the programs evolve so much. Like, you
Hopefully.
never know what has been implemented in between now and then. But yeah,
New advancements. They better step it up.
absolutely. So, go ahead and walk us through like what does a day-to-day as a dental hygienist look like?
So for me, I work 7 to 3 straight through. I love it. Great schedule. I get in, get out, it's done. But we usually start the day with a huddle meeting. So we'll go in, talk about patients, pending treatment, fun stuff like that. And then we just start the day. So for a typical cleaning, I'll see 8 patients a day.
Oh, wow.
Okay.
First 20 minutes is for health updates, blood pressure, x-rays, getting your exam, like my exam done, not the doctor's, taking my notes. And then usually 20 minutes of cleaning, sometimes longer, hard patients. And then the last 20 minutes is reserved for the doctor exam and then me doing notes and cleaning my room.
And reset.
So that will change if I have like deep cleanings or like kids or shorter, stuff like that.
Okay. Okay. Or like.
It's pretty monotonous. It's the same 20-minute increments of things that I have to get done.
So how long do you have in between each patient?
I don't have any time.
So you just go to the next one.
You go to the next one if you're behind. They usually blame you, and I'm like, usually it's your doctor's exam that you're behind for. Yep, no time.
Yeah.
So the easy patients we love because then we have like 10 minutes to go pee and get something to eat.
Yeah.
So you said easy patients. What's the hard patient then?
I don't even want to say hard patients, but the ones that you talk to more or the exam takes longer, stuff like that. They'll run you over.
Okay.
So what do you love most about being a dental hygienist?
The people.
The people.
I like meeting people from all ages, all walks of life, just meeting different people, different careers. But the people are also what make it hard.
Yeah. I feel like that's anything in healthcare though. Like you have to deal with people.
So like one day you just woke up. I love people and I really love getting in your mouth and spending a lot of time. I'm gonna really know you right here.
Oh, it's a personal space.
Oh yeah. For sure.
It's a personal space.
Yeah.
I always feel a bit awkward at the dentist. I'm not gonna lie, because they're like, oh, so how was your day? And I went,
Oh, yeah.
good.
Oh, yeah.
Yeah.
I try really hard to time when I'm going to ask a question.
Uh-huh.
I'll be taking my hands out of their mouth so that they can answer.
Oh, yeah.
Because it's when you sit there and you ask a question, and then it's awkward for me too when they're like, like
It's like, I don't know what you're saying.
I can't
Yeah.
talk to you either. So I always try and time it right to where, my hands are coming out of your mouth to answer my question.
That has to be hard if you're a talker. Like, I'm a talker. I mean, I would want to just talk your ear off and then like, oh, I have things in your mouth and I've got a job to do. And then, I mean, what do you?
I've learned to also read the room though.
Okay.
Like I have my talkers for sure, but then there's patients who I can tell like are like get me in and get me out.
Clean my teeth and get
so
me
I've
out
very
of
much learned how to read people and what they want. And like, and then there's ones too that don't talk at all because they're nervous. And then come the end, they're like, they don't shut up.
Yeah.
And I'm like, where did you come from?
So you can really tell like the patients that hate the dentist and that are just like nonchalant.
Oh yeah. And the guys are the funniest when they hate the dentist because they come in and they're on their phone and they're trying to like ignore what's going on. And I'm like, I can tell you're nervous. It's okay.
What makes people like hate the dentist though?
Usually it's past experiences from when they were a kid, stuff like that was more traumatizing.
Okay.
Dentistry's come so far now. A lot of those things that they're scared of don't happen anymore.
Yeah.
Like not getting numb. Like numbing has come so far. The noises and stuff, we have cancellation or noise cancellation headphones for them. Like, but usually it's a past experience that makes them terrified.
That's good. I mean, well, that's not good for them, but like, that's good that there's been advancements on it. Sloan, like he's now hit this like phase. He was fine. We've never had an issue with doctors, dentists, anything. And then once he turned 3, boy, I'll tell you what, we walk in and he's screaming like he's traumatized. I'm like, nothing has happened to you. It's okay. These are
kids are different.
People.
Kids are different. I love kids. So I don't see kids. I see maybe a few. Okay. But starting at like age 7 and up because we're like an adult practice.
Mm-hmm.
Yeah.
But I did work on kids in school and they're different. They're hard because you never know their mood and they can't express their mood.
Yeah.
So they're a little more difficult to work on for stuff like that.
Oh my gosh.
I have to agree with that.
That'd be hard.
One day the boogeyman's scary and the next they're not. So
yeah. Oh my gosh.
That's true. Gosh. I don't have kids yet, but
okay. Well, let's get into the nitty gritty.
Yeah. Let me spill the tea.
So first question I just want to know right off the bat, since we're friends, you can be honest with me. Do you secretly judge people's teeth when you meet them?
Yes.
In what way?
Yeah. So in what ways?
Like,
so yes, I judge in the sense of
like not even
I can tell that there's
I mean, like just in general.
chicken right in your front tooth. Like that's the point that I'm judging in. I'm not judging on you have a crooked tooth in the front or that I'm not judging on. But the ones that I'm like, okay, I know you didn't brush your teeth. That's what I'm judging.
How often does that happen? Like I would think.
Well, I know.
I'm going to the dentist today, even if I don't brush my teeth all week. Today's going to be the day. I'm going to do that this morning before I go.
Okay, well, Sarah, I would hope that you brush your teeth every day, but
I do brush my teeth every day.
All week, girl.
I had to brush my teeth multiple times today, but I'm just saying.
Y'all would be appalled at the number of people who come in my office and say, oh, sorry, I just had lunch, or sorry, I didn't brush this morning. And I can't look at them and say, okay, when you go to your gynecologist, you don't walk in and say, sorry, I didn't shower or I just worked out.
Yeah.
Like it's gross.
No.
Like, no, you don't do that. Or go to your doctor and say, sorry.
So how do you handle it if you can't tell them? Okay, that's disgusting.
I mean, I clean it, but on the inside, I'm not happy.
Yeah.
Yeah.
Just like, oh, it's fine. They're fine.
People say, oh, you brush them for me. I'm like, no, you brush them and then I help you get what you can't brush. But I'm not here.
I'm the type of person.
I'm not your mouth maid.
If I'm going to the dentist, don't want to be embarrassed. Like I want my teeth to look the best they have ever looked before. I will whiten my teeth the night before I go just so that they look better. Like using a whitening strip. I use them anyway.
Yeah.
But if I know I'm going to the dentist next day, whitening strip, 100%.
You're my favorite patient then.
Yeah. There you go. I mean,
I won't go so far that I always floss like right before.
Yeah, me too.
But I always clean teeth for sure.
If you brushed and didn't come straight from lunch, you're good.
Okay. That's awesome.
Yeah.
Good. Okay.
So with that being said, what's the weirdest thing you've ever found during a cleaning?
Ooh. kids that have braces a lot of times have weird stuff.
Oh.
Okay.
One the other day had an eraser, like the end of a pencil, like stuck in his bracket. And he was like, is that me? I don't know what that is. It was an eraser from a pencil.
Me.
A lot of time fingernails. People bite their fingers and it gets embedded in their gums.
Oh, that's
hair.
that's so
I found hair. People will chew on their hair. I guess it's a nervous habit. That's gross.
Oh,
It's
wow.
fun.
That's not what I was expecting.
Okay, so
But-
I do have a friend who's a dental assistant, and she told me one time, like she called me, like traumatized. She said, Sarah, I was, doing some work and like the air thing that, when you're
the air
drying.
water syringe. Yeah.
She said that when she turned that on, their gums just
Mhm.
flapping.
That's a thing.
What do you do?
And clean it.
Like how?
Well, if it's around their gums, you clean around it. If it's like flapping tissue from an extraction, they probably suture it up. But yeah.
What causes
So if their
that?
whole gums are that way, what do you?
Usually it's periodontal disease. Periodontal disease.
Yeah.
Okay. So it's like a condition.
Mhm.
Okay,
Yeah.
that's different. It's not like they.
But you normally don't see them. They're like that severe. That's
Okay.
like not
Wow.
normal.
Because I'm like, do you
Get that
look-
checked.
Like, so like, if you're experiencing this, go to your dentist.
Please.
See your doctor.
Go see your hygienist. See your dentist.
Oh my gosh, that's crazy.
We typically don't see severe stuff like that.
Yeah.
Like more at school because it was like the dentist at school had a free extraction clinic. So we would see some pretty crazy stuff because it was
Yeah.
free for
Yeah.
people like off the streets.
It's also good education and experience.
Yes.
for y'all. Yeah.
But in my day-to-day practice, I don't see stuff like that. Maybe like a perio office, but not in like a general practice. But that's pretty severe if you're flapping around with air water.
oh
Oh my gosh, I just can't imagine like one day you wake up and
Mm-mm.
be like, get me in the dentist now. Something's
Yeah.
wrong.
But
Oh,
people,
yeah.
if it doesn't hurt, people don't come. Like they don't realize
Really?
that there's like maintenance. I mean,
Yeah.
you don't wait to go to your doctor until you're dying. I
But
guess people do.
I mean, cosmetically, like that's a noticeable, right? I mean, that would be noticeable.
You would think.
So okay.
But
Interesting.
Wow.
people
Wow.
will wait till they can't sleep to come see us. And I'm like, dude,
Really?
now you're in a lot of trouble.
Yeah.
Right.
Whereas you wouldn't have been if you would have come 10 years ago. Yeah.
Could have reversed it.
Yeah. or
So
not even
how often do
happened.
you go? Like, how often do y'all recommend then? Like,
For an average, normal, healthy patient, every 6 months.
Okay.
For our patients that need a little more help, every 3.
Okay.
But that's usually when you have periodontal disease or
mhm.
people have some build up tartar really fast.
Yeah.
And it's just how they are.
Yeah.
So we see those more often. I have a few coffee drinkers who I see every 3 months because they're stain galore
Mhm.
that takes longer to get off.
Wow. How much coffee do you have
So-
to drink for
a
that to
lot.
happen? Like,
A lot.
I'm not a big coffee drinker, so I just don't get it. But
Well, and some stain faster. I mean, it's the same as like building up tartar faster. Some have stain faster.
yeah.
I mean, the pH of your mouth is different. And if you have dry mouth, if you have not dry mouth, it
Yeah.
affects how it all works.
Oh my
Wow.
gosh, wow. Okay, so what's like your top horror story? Like,
Oh, gosh. For me or the patient?
both.
Both. Give us both.
Spill.
My very first patient in hygiene school, like that wasn't a partner, wasn't a dummy. My very first patient, bless her heart, she was like 78 years old. Sweetest lady. I had the one chair in the clinic that rolled everywhere. So
Oh,
you
no.
stood up and it was gone.
Oh god.
I stood up to get the blood pressure cuff off of her wrist and the chair was gone. And I didn't know it. And I went to sit back down on the floor and she was like, you don't know what you're doing. And I was laughing and she thought I was crying. And I was like, what do you do besides laugh at yourself at
Yeah.
that point?
Yeah.
Oh god.
So for me, horror story would be that or like the x-ray cords because they plug into the computer, tripping on that. I've done
Okay.
that before.
so just embarrassing.
Yeah.
Yeah.
But horror
Okay.
story patient wise, I mean, I've been kind of lucky. I've seen patients that aren't my patients that I would be like, no, man, go somewhere else.
Yeah.
But that was more when we were shadowing like the dental students in school or like the oral surgeons
Mhm.
or like on mission trips when you go to third world countries.
Have you done any of those?
yeah.
I have. I've been to Guatemala.
Oh,
It was
very
really
cool.
fun.
With what program?
The school.
Oh, okay.
We did it through a church group in the school.
What did
That's
that?
awesome.
What did that?
That's fun.
Yeah, that's really.
Very eye-opening for sure. I'm thankful that we have a lot of products we can use to keep your teeth clean.
So,
Yeah,
what
so-
does that mission work look like? Kind of.
So for the hygiene, it was a school that we went to,
Uh-huh.
and they know every year the same dates people come. So there was a flood of kids and all the way up to 18. And they'd come in and we'd clean their teeth, and then they would go see the dental students, and they would do like restorative work. But you can't do crowns because crowns take a few weeks to get back. So it's a lot of also extractions. It's hard. Like on little kids that have big cavities and stuff, you can't
Yeah.
fix it. Like it's too big for a filling, so you
And
extract it.
When you do that, do you have like the same medication? Like y'all bring.
Mhm.
The
Oh yeah,
medication
we bring
and stuff,
everything.
okay.
So they're not in pain. They're not.
That's good.
It doesn't. Nothing hurts them, but you don't have time to fix it or the resources to,
So I imagine that some of them like probably don't even have toothpaste.
Oh, yeah.
Right? Like
Oh yeah, we give out huge goodie bags, and they don't even know what's in them. Like they see a toothbrush and they don't know what it is.
Aw,
So
that's
we like have a
sad.
whole, like there's like 10 of us that go up front, and like our job was teaching them how to brush their teeth. So we would
Wow.
rotate like
Wow.
seeing patients, but we would have girls up front showing them what it is and how to use it.
wow. That's crazy.
In Spanish, trying to.
How fluent are you?
Not. I got dientes, I got lingua, which is teeth and tongue.
Don't
Yeah.
even know what those things
The
mean.
basics.
Yeah.
Yeah, good. There you go.
got
there
the
you go.
basics. I can get through a dental appointment, but cerveza. Margarita. I'm good.
After
Well,
you
that's
drink those, brush your teeth or
Yes,
drink
please.
some water.
Please
Yes,
brush.
please.
That's funny. Oh my
That's
gosh.
so awesome.
Yeah. That
Wow.
is. That's really
See,
cool.
you never know how good you have it.
You never know.
Yeah, I bet that's eye opening for sure.
Especially anything medical
Mhm.
in
Yeah.
a third world country is eye opening. So you got it good.
Yeah, absolutely.
Well, that's awesome.
Okay, I've been curious about this. So, like, I use activated charcoal sometimes.
No.
And I want you to debunk this myth because sometimes I'm like, oh my gosh, look, they're wider.
Mhm.
They're a little bit wider.
Yeah, actually.
But I'm like, is
my-
it because you just blacked out your mouth and that's why it's like,
It's so abrasive. It's abrasive. So yeah, you're making them wider because you're scrubbing off what's on them.
okay.
But with like baking soda too, it's too abrasive. Don't do that. Don't do that. You don't need that.
oh, really? What about like
Yeah.
hydrogen peroxide? I've heard that.
Oh boy. Um,
Wait, that ties into oil pulling too.
yes.
which I've
Okay.
never
So all
done,
the
but,
fun
like,
things. So peroxide.
Oh my gosh.
It's just like when if you use it too much, it's not going to work anymore, right?
Right.
Mhm.
So people will use it once a day. Okay, well now the benefits that it's giving you, you're immune to. And we don't recommend doing that anyways. It's not, I mean, maybe like once every few weeks or once every other week.
the oil pulling aspect?
No, the peroxide.
The peroxide.
Oh,
okay.
I cannot swish peroxide in
Oh,
my
it's
mouth.
gross. I've tried
That's
it.
Disgusting.
I get curious and try these things sometimes when patients do it. That one was gross.
Okay.
I might have had some tummy stuff. Don't do that.
Oh god.
Could
you swallow it?
No, but I mean, it's just like the thought too of like, okay, this is what you give dogs to throw up. Like, why are
And
you
you
swishing
do.
this in your mouth?
Yeah.
Like,
Oh, I've never done that.
oh yeah, if your dog eats something and you need them
Yes.
to throw up, yeah.
Really?
Yeah.
So don't swallow it
So
for
when I
sure.
used to work at the vet, if people would bring their dogs in and like they ate something really bad, that's the first thing we would do is hydrogen peroxide and make them
Because
throw
it's,
up.
and I'm assuming it has the same effect on humans.
Yeah.
Oh.
I mean, I didn't swallow it, but I don't know. It was probably in my head.
Mhm.
I was like, no, man.
Oh my
Even
gosh.
tasting
But like
it,
antibiotics too, like if you're going to use it every day, it's not going to be effective.
Yeah. That's
So
true.
that you
That is
don't need
true.
to do that. Oil pulling. So for those of you who don't know oil pulling, people say it reduces the bacteria in your mouth.
Mhm.
It's disgusting.
What exactly is that? Because I was trying to like
You take a big old spoonful of coconut oil, you put it in
Right.
your mouth, and you
Okay.
swish it for like 3 to 5 minutes or something.
ugh.
Tried that too. It's disgusting. It gets warm and like liquidy. It's like olive oil by the time that it melts. It's gross. That's not going to hurt you. Do what you want. If it helps you, keep doing it. There's no evidence that it helps long term. Most people will do it a few days in a row and then it's gross to them, so they stop. I don't have any patients that have continued doing it for like long term use, but studies show that it's not effective long term.
Okay.
So,
Well,
but
that's good
if
to
you
know.
think it helps you and you like it, it's not going to hurt you. So you go, girl.
you go, girl.
keep
See,
doing it.
folks, don't do everything you see on the
Keep
internet.
doing it.
TikTok.
TikTok will
It's
get
a
you.
big
Wild.
old-
Oh, and
Yeah.
I'm crunchy too. Like I'm crunchy. I make my own beef tallow lotion. I like no
What is
dye.
Beef towel lotion.
Not my mouth.
Do
Not in
you
your
feel-
mouth.
do you
Do not
feel-
put beef towel in your mouth and swish it.
Do you feel like it's been working?
Oh yeah, I love it.
Really?
My acne's gone on my face.
You haven't heard of that for like moisturizer?
tallow.
Okay, what kind do you
That's
get?
a good TikTok trend.
What kind do you get?
We butchered a cow, and so we've eaten
Okay.
the whole cow, and we got the beef fat from our cow we bought.
So it's like
But-
legit.
Yes,
Nice.
and then I add my
Guess
own
I got to go butcher a cow.
essential oils and all the things to it.
There's
so
so
I'm
many to find
crunchy,
and
but
do.
not all things that are crunchy are good.
Yeah.
Yeah, agreed.
But yeah, oil pulling's not going to hurt you. If you want to do it, go for it.
Okay. Good to know.
But just because you see it on TikTok doesn't mean.
I can't say that I've ever seen that and been like, I think I'm gonna try that tonight.
I don't think I want to put coconut oil in
But
my
I
mouth.
definitely fell into the barbecue residue charcoal.
Mhm.
Oh, me too. My toothbrushes.
When you put it like that, barbecue residue. I'm going to tell my patients that.
There you go. It's kind of, it really
Go get the
does.
charcoal out of your grill
It
and
kind
put
of
it on there.
is.
There you go.
It's too abrasive. Bottom line, it's too abrasive. You don't need that.
makes sense. Okay. Okay.
If you want a good whitening toothpaste, Sensodyne True White is my go-to. It's not abrasive at all.
Okay.
It's got the whitening properties in it and the sensitivity properties,
Mhm.
so it'll do both for you.
I
That's a
need
good
that.
So bristle wise, do you say soft,
Soft.
medium, or hard?
I don't know why they make hard. Our reps come in and tell us this is not to brush your teeth. They don't even bring the hard ones in the office.
Really?
So I don't know why they make them to clean your toilet. No, you don't need hard, okay? You need
Wow.
soft.
well.
You need soft
Okay, we're still
toothbrush.
talking about toothbrushes here.
Yes.
I'm sorry, but
Nope.
Oh my god.
You need soft
anyway.
toothbrush.
That's funny.
good to know. What
Okay.
what's your like number one toothbrush recommendation? Because I need a new toothbrush.
Okay, so I love Sonicare.
Okay.
OG, great toothbrush.
I used to have one of those.
I also really like Oral-B has a new one out.
Uh-huh.
So the Oral-B old ones were kind of rough to me,
Mm-hmm.
real finicky. The new ones, the IO,
Uh-huh.
are great. They have the same motion as the Sonicare, so it's more of a sonic movement than like a rotation.
Okay.
They are super expensive. So just get the baseline IO. You don't need the Bluetooth and all of that. If you want it and you have money for it, go for it. If not, the baseline, Sonicare, baseline, Oral-B IO
Okay.
are the best.
What's the difference with a Bluetooth? You can just like jam out.
They have Bluetooth where you can like,
track your stuff.
yeah, it's on your phone and you can look how long you brushed in one spot or the other.
I don't think I want to know.
It's really cool for the first like 2 times you use it. I
Yeah.
mean, then you never use it again. So
Yeah.
to spend the extra $200 on it
Yeah. You're like, no.
in this
no.
time, in this economy, no.
no, not right now.
Not at the moment.
So it's cool.
Okay.
If you like that kind of stuff, go for it. But
Okay. Good to know. I'm always looking for a new toothbrush.
yeah, if you're balling
Me
on a
too.
budget, you just need the baseline. Make sure it says pressure sensor. That's the one thing is pressure sensor, but the baselines should have that.
Okay.
Now the ones that you see in the grocery store or on TikTok that are not brand name, I don't know. I'm kind of iffy on those.
Yeah. You don't buy
Some
them all
probably
and try
some
them?
probably work are really good, but some I would not recommend.
Yeah. So that's toothbrushes. What about floss?
Oh, girl, please floss.
So how often are you actually like
Like-
really supposed to floss? Every day?
At least once a day.
Okay.
But I mean, let me be
Okay.
honest. If I don't have my floss picks in my car,
Don't tell your dentist to watch
Yeah.
this
Yeah.
episode.
don't watch this.
They're going to be disappointed in you.
No, I will be honest. If I don't have my floss picks in my car, I'm the same as y'all. Like when I get home and when I go to bed, another step in my nighttime
Yeah.
routine is not what I want to do.
Mhm.
So now I have my little bag of floss picks in my car, and on my commute to and from work, I'm sitting there flossing. It's you got to find where it's convenient for
That's
you.
a good idea.
But
Yeah.
once a day is ideal.
Okay, wait. That brings me to another question. So back to the TikTok thing. I saw a video on TikTok where I think it was a dentist. I don't know. Don't come after me. But she said that you're actually supposed to use mouthwash.
Mhm.
I think it was mouthwash, floss, or maybe floss, mouthwash, and then brush your teeth. What's the correct order?
Okay, that's a big argument. I like the idea of flossing first,
Okay.
and then you brush away what you floss.
Yeah.
Some say the opposite, like you brush and then you floss what you don't brush.
Okay, but what about mouthwash? Where does that fall in? Because I
I would do that
tried it.
last.
I have tried
Yeah.
it, and I actually like my teeth felt a lot cleaner after I did mouthwash first and then brush.
Because then you're swishing out what you've just worked on getting out.
Right.
I like mouthwash last, but I also
It makes you feel more clean,
use it
right?
throughout the day.
Yeah.
Like if I go get a snack at work and whatnot, I'll go use mouthwash really fast. And
Okay.
but
Must be
floss at
convenient.
least once a day. I promise it's a good thing.
To each his own, really. Like whatever
Yes.
order.
Well, my
just-
favorite thing ever is when patients come in and they're like, "Oh yeah, you make me bleed." And I'm like, okay. When's the last time you flossed? 6 months ago when I did it for you? You're gonna have bleeding gums.
Why is that?
It's the bacteria built up.
Okay. It just so it gets so
Yeah.
irritated and agitated.
So when you floss, you're actually supposed to floss under your gums. Like people don't realize that. People will just like flick it in and out. That's not right. So you're supposed to actually fully like hug your tooth and go under the gum line, and then hug the other side of the tooth and go under the gum line. So if you're flossing wrong, you probably bleed too. But
I'm flossing wrong. I'll be quite
I
honest.
am.
People
Wait,
brush
what do you
wrong, too.
mean? Under the
So like
gum
then
line?
is a pick better, a water pick better, or
okay, that's an argument too.
pull it out of the tube.
People will tell you the picks are not good. If you are using the pick right, you're fine. If you're doing something over nothing, pick it out. Go for it. Use your pick.
Yeah.
You got it. Like for me, I'm not going to go to the back of the bathroom drawer and get my little floss from my dentist and use it.
Mm-mm.
Now, if I have a floss pick on hand, I'm using it every day, twice a day.
Yeah.
Okay.
So if you're using your floss pick right, go on Google, look on YouTube, how to use a floss pick. It's easy.
Okay.
It's just people don't know.
Okay.
See, I use floss picks, and I'm kind of one of those in and out people.
That,
but
me too.
but I sit there in one spot for a while. Like I'm,
You get in there
Going
real
to town.
good.
well, yeah, like I don't
People
know.
brush wrong too, though.
Well, and I probably am doing it all wrong, but
Yeah.
it's worked for me. I've never had a cavity, so I guess it's good. But I'm like, I've never been told. Like maybe I just need to educate myself. This is why we're here.
Yeah, that's why we're here.
No, people definitely brush wrong too. Nothing drives me more crazy than whenever I see a movie and the actress or actor will have an electric toothbrush and they're sitting there like scrubbing with it. It's not how you use that at all. And it drives me nuts.
So show
So
us.
what's the right way? So if it's electric, are you supposed
should've
to
bought
just
a
let
new
it?
one.
No,
like,
if it's
do
electric toothbrush, do not scrub. Do not scrub.
You just
Okay.
move it.
You hold
Wait,
it
that's
in
so
one
weird.
place. Yeah. It takes a lot of getting used to. Like if I'm not paying
Sarah,
attention,
don't do that.
if I'm not paying attention when I'm brushing, I'll sit there too and like start scrubbing. But you're not
Yeah.
supposed to do that. You hold it in one place at like a 45-degree angle towards your gum line, and then you just slowly move it across your teeth.
Okay.
That
So if
goes
you
against
scrub with it,
everything
I've
yeah.
ever learned.
If you
ever
scrub with
known.
it, you're canceling out what it's doing for you.
Wait,
Wow.
what?
Yeah.
Why? Because you're just spreading the bacteria around. If you're
Well, no,
scrubbing, or
you're
what?
just the vibrations are what's supposed to be like brushing for you. So if you're brushing on top of the vibrations,
This is true.
if you're brushing on top of the vibrations,
That makes
you're
sense.
canceling out what it's trying to do for you.
God.
My husband would actually really appreciate
Yeah.
hearing this because the other day I was like, every time I like brush, my vibrating stops working on my brush. He goes,
You're pushing down too hard.
he's like, why are you even doing that? He's like, it does it for you. I'm like, no, you're still supposed to scrub.
like the pressure
Oh.
sensor I told you about. That's what
Mhm.
that's for. So when you're
Oh,
pressing
okay.
too hard, it will tell you, no, ma'am, back off.
Okay,
Wow.
that's for learning
And
so
then
much
like with your
here.
manual toothbrush, don't just go back and forth. Like actually like go towards your gum line, go in small circles. Like you actually want to brush your gums as well. Not like all the way down, but your gum line, you need to brush your gum line too.
I brush in like different directions. I go this way and then like
Oh yeah, all the
this
things.
way. Yeah.
People will get in there and just go
Yeah.
and be done. No man. There's so much more in there you gotta get.
Gotta get all sides of your teeth. So I've heard that dental hygienists can tell what recreational activities patients partake in, even if they lie about it. For instance, like smoking cigarettes, smoking weed, drinking, other recreational activities.
yeah.
Cocaine.
So give us the tea on all
I
that.
can
Yeah,
tell
tell me.
a lot about someone from their mouth, and I can
Oh.
tell what you've been doing, what you've been up to. My favorite is patients come in and say, "Oh, I'm not a smoker. I have a nose. It works very
Yeah,
well.
you can- yeah.
I can smell through my mask, and the minute I touch your gums,
Ew.
you can smell it." Patients who smoke for fun usually have really dry mouth, cotton mouth.
Yeah.
You know, you get that when we don't do that, but yeah, patients who smoke for fun dry mouth, you can tell.
Wow.
For the other super fun activities that we don't speak of, yeah, you'll have bruising in your throat.
In your throat?
And I can see
You can
it.
see it?
Mhm. Like up on your hard palate. If you went to town, I can tell. And I'm not going to say anything, but on the inside, I'm laughing.
Oh my god!
On your soft palate or your hard palate.
Wait. Okay, how often do you get patients?
Very
who come with
rarely.
that?
Very rarely.
Okay. Wow.
Very rarely. But yeah.
I mean, I don't have.
We've seen it.
But like,
And I thought it was only like, okay, a once in a lifetime thing in my textbook.
And then you saw it in
Yeah.
real life. And
Real
you're
life.
like,
But it's probably
okay.
like a once every 5 months thing that I'm for sure that's what
a
it
little
is.
too
I was
often
like,
for
that's
me.
common.
Yeah.
wow.
Every 5 months.
And I'm usually like, okay,
Okay, wait.
you go, girl.
So can you tell like differences between like if someone smokes, can you tell like what they smoke, like cigarettes versus like
Yes.
weed or
So
I don't know,
usually
vaping, like all the different things?
If they're smoking cigarettes, they usually have gum disease with it.
yeah.
If they're smoking weed or vaping, typically they don't. The vaping's still so new, it's kind of hard
Right.
to know long term, but the difference in weed and cigarette, yes.
You can tell
Mhm.
a difference.
Because usually if you're a cigarette smoker, gum disease is inevitable. It comes
Yeah.
with it. It's
Yeah.
part of the territory. And they don't really have dry mouth. They don't have cotton mouth, typically.
Yeah.
But yeah, you can tell.
So when you said smoking for fun, are you talking about like people who smoke cigars and stuff?
Oh, weed.
Weed. Okay.
Oh,
Yeah.
I mean, I don't do that, so I don't know.
Cigars are hard to tell because they probably do it at night. Like,
I mean, I've smoked
Yeah.
a cigar before,
Yeah.
and that
Yeah.
cotton mouth for sure.
The
So I
ones-
can imagine.
they usually don't do a cigar before their dental appointment. I'd
Well,
be
you'd
concerned.
be surprised. You said
Um,
people don't even brush their teeth before they
True.
come in. So,
But people, okay, I did have a patient. He was almost 100. He was 99.
wow.
Oh wow.
He was actually a pro baseball player. He would come in, or he used to be, not when he was 100 years old.
Yeah.
He would come in and he would chew on a cigar all day, every day.
Oh no.
Cutest old man. And he would sit it on the little cabinet while I cleaned his teeth.
He's like, I'll get back to you.
And then
later.
he would get it while we were waiting on an exam. And so then my doctor would come in and just look at me and I'd be like, I promise I cleaned them. But when you're chewing on a cigar, you'd get like those little black specks and stuff.
all the tobacco.
But
Ew.
he did what he wanted when he wanted.
Yikes.
He was allowed
Lived his
to.
best life. Hey, at that point, who cares?
I
You're
know.
100.
He was still with it mentally and he
That's
didn't care.
awesome.
But it's the everyday smoking or like the right before
Okay.
that I can really tell.
Because like my
Yeah.
husband occasionally will smoke a cigar, or like all the grandfathers, like my dad has my
Mhm.
puppy's entire pipe collection, and so it's just, you know, occasionally they'll smoke a pipe, but
Yeah, I can't tell with that. But there are people that come in high as hell. I mean, because probably because
Really?
they're nervous too. But it'll be professional people.
Like, I'll pre-numb myself.
Professional people will come in high, and it
Oh
makes
my-
me laugh. But I mean, they just sit there like this and
Professional
they just
people.
doze out.
Oh.
But I can tell.
Do a lot of people
Or
nap?
maybe
in
it
your
calms
chair?
their nerves.
Yeah.
What do you
People
prefer?
push
Do
them
you
up.
prefer your
Yeah.
patient awake or asleep?
Awake.
Wow.
I've cleaned some teeth that people are like knocked out. It's just hard
Uh-huh.
because they'll be snoring and won't open fully.
Oh.
Or like you have
Yeah.
to close down
Yeah.
at times too, so you can
You
get-
just go. Just shove their
Which, by
mouth
the way,
out.
y'all, the way people close on a suction is maddening.
Yeah, because like,
Yeah. I do
Oh, no,
that all
there's,
the time. It's
there's
like,
all different. That's normal, but there's
Okay.
all different methods people use. Like there's some that close like 8 short times on the suction.
like
Yeah.
why? Or do some people like literally stick their lips on it?
Oh yeah. There's some that
What?
like want it right on the tip of their lip, but then water goes everywhere. There's some that close on it and keep sucking on it until you say open. I'm like, you're about to backflow everything in this office. Quit sucking on the suction.
Oh.
you know, I've probably done that before.
Yeah. I feel like
Just-
Because I got. Am we done?
yeah, I'm always waiting till they're like open. And I'm like, okay.
We're like backflow.
You're like, thanks. Wow. See, those are things that like I would never know.
Yeah.
People can't figure it out. It makes me laugh. And then when I get my teeth cleaned now, I'm trying all their methods. And so my other hygienist, she's like, stop.
Don't
Stop
do
doing
this.
that.
We know
so
better.
sometimes
That's
though,
funny.
whenever I go to the dentist, there are times where like I feel like my mouth has been open too long and I really
Mhm.
need a break,
Oh,
but I
yeah.
don't want to say anything.
Yeah.
How do you what's the best way to go about that?
I don't know.
Like, can I just like
I
raise
feel
my
like
hand?
Oh yeah.
Hey.
Oh yeah. Just be like, yeah, raise your
Can
hand
I
or
shut my
something.
mouth real quick?
Yeah.
I feel like I'm really nice. I give a lot of breaks because I
That's
know
good.
it sucks. People have jaw issues and stuff like
Well,
that.
and sometimes I'll get so much spit.
Yeah,
Me
people
too.
will freak
I'm like,
out.
I'm
Can you
like
get
about
the
to drool.
suction out?
People will
Like,
freak out. So, I mean, every little section I clean, I give them the ejector. People
That's
will be
nice.
like, okay, that's too much. Like, I don't have, there's something in there to suction. But I'm like, okay, well, it's that or you're drowning.
Yeah.
Like, there's no happy medium.
Yeah. Wow.
Because you have the
Yeah.
patients that are like, stop, I don't need that. And the ones that are like, ah, you know?
That's me. I feel like I'm drowning all the time there.
But
Please.
I feel like I try
funny.
really hard to pay attention to that
Uh-huh.
and give them lots of breaks because, I mean, I get it. I've been
Yeah.
a patient too.
Yeah.
But no,
So
people
do you
are
all
just funny.
clean your own teeth then in the office?
Oh, all the time.
That's good.
Well, I clean mine at home too by myself.
Oh, nice.
In the mirror.
You have all the equipment.
Oh, yeah. I clean Waylon's teeth too, my dog.
Yeah.
Oh, wow.
That's
So, yeah, he has his own set of scrapers. So every 6 months, I get in there and get his tartar off. And when we go to the
That's
vet,
nice.
I'm like, tell me his teeth look good.
Let me
Tell
know.
me.
Heck
Can you
yeah.
come do my dog too?
Yeah,
I know how to do some of it. I used to work at a vet, but like that'd be pretty cool.
I started when he was like 9 weeks old, just brushing him with peanut butter toothpaste from PetSmart. And
they
then
love that.
Interesting.
we go on a long walk and I wear him out and then he lets me clean his teeth.
Wow, maybe I need to try that. Yeah, they do that at vet. I mean, at
Yeah.
grooming appointments. I'm assuming,
There's, if you,
well,
yeah, I can.
or if you just take
You
your
can
dog to
brush
the
your
vet.
own dog's teeth, but then they can do what's
You've met
called.
my dog. You think that's gonna go very well?
I do it with Willow all the time. She lets me put the toothbrush in there. and
They like the
everything.
peanut butter toothpaste.
But then
do
you
not
can-
use human toothpaste on your dog.
No,
Oh yeah, no. I
there's
would not.
different
The
toothpaste.
xylitol and the toothpaste that we use is not
It's
good for
to-
them.
It's
Yeah, it's
toxic
toxic.
to them.
Yeah.
But then you with your dog you can do what's called a dental, and that's where they actually put them under, and then they go in with like what do you call the thing?
Or ultrasonic.
Yeah, the ultrasonic.
I love that
and
thing.
it gets all of the tartar off and everything.
Patients hate that thing sometimes.
Why?
Have you had it before?
I'm not sure.
It kind of vibrates and spits out water. Like while they're cleaning.
So.
That means you have really clean teeth.
Oh,
That means they didn't need it for it. I mean, I use it on every single patient, so I shouldn't say that. But it's a vibrating water pit kind of.
okay.
So it knocks off tartar really fast and easy. I call it my wrist saver. Because I get all the big stuff off, and then
That's
when I go
awesome.
back, it's just like the little things.
So, what's like your favorite technology that you have in the office, or a technology that you think is useless?
The new X-ray technology is amazing. You still have the hard sensor in your mouth, but we have like little point and shoot guns now. So I don't have to like put the X-ray head up to you and run around the room and push a button.
Mm-hmm.
Now I literally put the sensor in and then point and shoot my little gun, and it's 2 seconds.
Oh my gosh, that's awesome.
So for patients who gag a lot or like kids, it's a lot easier.
That's good.
Also, the one
Mhm.
now that you just put your head in and it goes all the way around.
Oh yeah. So that's not new. That's been around for a long time, but you don't do them very often.
Yeah.
It's like once every 5 years, or like if you're doing ortho. But
That's
people
like if
people
you're getting
always say,
Invisalign
why
or
can't I
stuff.
just do the one that goes around your head?
Oh,
It's
okay.
great for like a full picture, but for individual teeth to diagnose cavities, it can't see.
Mm.
Yeah, you got to be
Yeah.
really close up.
But
Interesting.
they're about to roll out AI for dentistry for our X-rays, which I'm really excited about. You can show your patients for sure, like that definitely is a cavity. It'll tell them.
Oh my gosh, that's so cool.
Which AI and radiology is great, even for healthcare.
Mhm.
So what does that look like? Is
Mhm.
it still going to be the same like guns and there's just like
Oh yeah, we'll still
AI behind
we'll
it,
still
or-
take the same X-rays, but the AI will read them, interpret them for us. So there's no
Wow.
question of like, oh, that might be a cavity. We'll watch it. It will tell you exactly what it is and how big it
Wow.
is.
Dang.
So you can't tell
amazing.
your dentist, no, I don't have cavities.
Okay, wait.
now it's
since
your
we're
dentist
talking
and
about that,
AI telling you.
I have a question because so I think this is TikTok again, just getting in my brain, but it's all good questions. Some people are like, oh, I went to one dentist and they said I had like 4 cavities. And then I went to another one and they told me I didn't have any. So
Yep.
in your experience, and not talking bad about anybody, but are there maybe some dentists that possibly maybe say you have a cavity because it costs more to get done? Or do you think that, I mean, I don't think that's
Yeah.
ethical, but I'm sure that it happens. That's my question.
It happens. I am more on the conservative side of dentistry.
Okay.
So some dentists, if they see a stain on your tooth, are like, okay, I'm going to fill it.
Mhm.
I like a dentist who, if it's stained but not sticky, we're going to watch it.
Okay.
Or like some dentists won't fill. Okay, so in your tooth you have your enamel and then your dentin, right?
Right.
So some dentists will fill cavities that are only in your enamel. If you're more conservative, you're going to wait until it's all the way in the dentin. So one's just more proactive than the other. I don't know. That's kind of a hard one.
So you prefer the dentin?
I prefer a more conservative approach, whereas it's a full-blown cavity. It's not going to just chill.
Yeah.
Have you ever had a cavity, Sarah? No? You said no?
No cavities.
Have you?
No cavities.
No cavities, no braces until...
You want to know a fun fact?
I do.
Yeah.
I'm also missing 8 permanent teeth.
8?
Wait, what?
8 permanent teeth. It's called oligodontia.
What's that?
It's where I'm missing more than 6 permanent teeth.
Where?
So I'm missing 4 wisdom teeth.
Because your teeth look perfect. So where?
Thank God mine are not in the front. They're in the back. So I'm missing 4 wisdom teeth, 2 second molars on the bottom, and then my second premolars on the bottom.
Because you're supposed to have how many teeth? 26?
32.
Oh, 32. God, where did I get 26?
32.
You'd have a hard time too. No, just
Wait, now I want to count mine.
You're like,
lucked out. Mine are in the back. But yeah, I have baby teeth still.
oh my gosh, that's crazy.
Because there's no permanent tooth underneath them to push them up.
That's awesome.
So that's wild.
Thank goodness I don't get cavities very
Oh.
easy because then I wouldn't have them.
Have you
Yeah.
ever had one?
Mm-mm.
Nice. Me neither.
No cavities. I just got lucky.
I did not. I was telling Kelsey earlier, I'm like, as a kid, I would brush my teeth twice a day, did all the things I needed to do, and I had 2 brothers. Okay? They're
are
boys.
Let's
Yep.
be real.
would not brush their teeth some days. Okay, they're little. We go to the dentist all together.
Even when they're not little.
we go to the dentist all together. Yeah, true. I have 5 cavities and the boys have none. Are you kidding me?
Yeah.
So, and then even as an adult, like I've gotten so much better than I was as a kid at taking care of my teeth. And I go to the dentist and I still have cavities.
Wow.
Don't understand. Yes, I'm outing myself here, but
No, it happens. It's different
frustrating.
pH levels,
That is.
different amounts of saliva. Like pregnant patients, you'll always hear.
I have heard that before.
It's
Yeah.
because everything's changing. Your hormones are changing. Your pHs are changing. It's all different. It affects your whole body. Or like people who are going through puberty, it's gingivitis for sure because your hormones are going crazy.
Yeah.
So when you're pregnant too, you can get gingivitis super easy.
Dang.
But it's just hormonal changes. A lot of times what you drink, what you eat. But yeah, everyone's just different. I have patients who never brush and have 0 cavities.
Yeah.
Oh my
What?
gosh.
Yeah.
Just rainy breath instead.
It makes no sense.
Sometimes yeah, sometimes no.
Really?
Yeah. Usually I feel like bad breath comes more from like gross tongues. So like tongue scraping is huge for bad breath. And get a metal one, like a metal tongue scraper.
Okay.
People who have like broken teeth and stuff, it's more the decay that stinks.
Uh-huh.
Or like impacted wisdom teeth, like where they're partially out and they're partially not, that aren't cleaned around.
Mhm.
I feel like that stinks more than like plaque.
Weird.
So some people have wisdom teeth that just like never break through the gums?
Yeah.
Because I've never gotten mine removed, but I also just don't.
Some are so
have
impacted
not
that
been?
they say leave them.
Okay.
It's the
I
ones
guess
that
mine
are
impacted. I don't know.
well, and they
feeling
do it
my
so
mouth.
young because it's not the
Like-
root's not formed.
I think so. These
Right.
2 have busted. They're halfway through. And then that one's still, he's chilling. He's in there. That one's coming.
If you keep it clean, it's not going to stink. But like for some people, it's so far back there that they can't keep it clean
Yeah.
that's usually like what stinks.
Ew.
And then they get mad they have bad breath and want to know how to fix it. And I'm like, well, we've been telling you for 8 years to remove those teeth, but what do I know?
I was supposed to have mine taken out like 8 years ago.
How do you handle that when
Yes.
someone's breath is like really bad when they come in?
Girl.
Do you keep it inside or are you
see
like
the wonky donkey ranky dinky?
I keep it inside, but
or like if you're giving
yeah.
their aftercare like instructions?
Yes.
Are you really harping on like, hey, brush your teeth, tongue scraper? Like,
oh yeah, if your breath's pretty rank, I'll make sure you brush twice a day. I'll usually put mouth rinse and a tongue scraper in their goodie bag. Just a little hint. Because I don't want to be
PSA,
rude.
If
Like,
you're getting those things, you're not doing a good job.
you might be. I don't know.
Wink, wink.
Every place is different what they give out. But if I'm putting that in there personally, you need it for a reason. No, but I keep it cool.
Yeah.
But people think I can't smell with my mask. I can smell. So like people come in like with coffee breath. Please don't.
Just brush. Brush your teeth before you go to the dang dentist. Floss.
Or I had a little kid the other day. He wasn't little. He was probably 8. He tooted in my chair. And his mom said his name. And he goes, what? She can't smell in that thing? Talking about my mask. And I was like, I can.
Yeah.
I can smell it all, buddy.
I smell
And
your
I
roast
heard
beef
it.
from last
Yes.
night. Ew. Okay.
But yeah, that too. People will come to their appointment with coffee.
Do y'all wear
what?
glasses too?
Yeah. Yeah.
Okay, so like if you have something pulling
Mhm.
up on you, your PP.
I have
Okay,
used
good.
the eye wash station before though.
Ew, why?
I was being dumb. I was in a hurry. And the dentist came before I was done cleaning. And so all I had to do was floss.
Mm-hmm.
And so I was like, okay, I'm already gloved up. I'm not taking them off to put my glasses back on. So I'm just going to floss really quick and be done. Well, when I was flossing, it popped out. It popped right.
What
was
I
it?
had to. I mean, just like debris, like probably polish because the polish will get stuck like
Yeah.
in between their teeth and stuff. It popped out, hit me right in the eye. I was like, mother trucker. And then for the poor patient, I didn't even say anything. I just took off to the eye wash station and stuck my face in there.
Yeah.
That was not fun.
Oh
I
my
don't
God.
recommend that. So now I wear my glasses every time.
I've never had to use that before, but I was always
Don't
terrified,
recommend.
like in high school. and
Don't
everything, of
recommend.
that eye
Of the
wash
eye wash
station.
station.
It-
Like chemistry
teachers-
class, it's like
Your teachers are like, do not use this thing or the
Oh.
shower. Oh God.
It was mortifying. And then my doctor was mad at me, of course, but
yeah.
Of course.
he wasn't mad, but he was like, seriously,
Yeah.
that was preventable.
Yeah.
And I
Yeah.
did it,
happens.
but-
Did you like everything was fine though? No.
Oh yeah, it
nothing
was all
happened?
good. We're all
Okay.
good.
Okay, that's good. No pink eye. No, nothing came from that.
No
Good.
pink eye.
Good.
No butt
Okay.
germs.
No. What's the funniest or most bizarre thing a patient has said to you mid cleaning that has just like stopped
Oh.
you in your tracks?
Do y'all want to know the inappropriate one?
Yeah.
I was a student
Okay.
and I had a patient who came in. I thought he was really cool because he had a dog, right? So I'm like all pumped up. He's like an older man.
Aw.
Told me he was a bounty hunter. But
Oh.
he comes in
Whoa.
and slowly starts making inappropriate remarks, right? So I'm like, did I hear that right? So we sit down and I go to clean his teeth and he goes, you can rest those right here on my forehead.
Rest what?
And I said, what?
oh.
Yes, he was talking about my boobs.
Oh.
And I asked the same question you did. I said, rest what? And he literally looks at me like this. And like
Those
looks at my
big-
boobs. And I said, y'all, it's like my second patient in school. So first patient, now I've fallen out of the chair. My second patient is being inappropriate.
You're like, this maybe isn't for me.
Yeah.
And I'm
That's
like,
I've
what
been
in the world?
Contemplating life.
I said, I'll be back. And so I literally went and go get my like male instructor. I'm like, what do I do? And he's like, no, we're not doing that.
Oh.
So now he can come to the school, but he's only allowed to see male hygienists,
Wow.
which is rare. So good luck to you if you get one. But yeah,
Oh my God.
So
that was-
hilarious.
So I'm actually really glad that is really funny, and I'm sorry, people. I just don't understand people, but
we deal
I'm
with
glad
that a
you-
lot
Yeah, we do
too.
with that a lot as well. Yeah,
I
really
laughed it
glad
off
you
at the
said
point, but then, the longer I think about it, I'm like, that was really freaking appropriate, man.
that. Yeah, you're like.
But in the moment, I was like, oh my God.
But like you just have the personality where you're able to be like, oh,
Yeah.
stop it.
Like,
You know?
nothing really
Yeah.
offends me.
Yeah.
And
Which is good until
Honest-
it's like
Yeah.
that was kind of far.
I'm like, well, what if he would have been hot? Maybe I wouldn't have gone and gotten my professor. I don't know. But
don't,
no, I'm just kidding. Don't let anyone do that to you.
no, don't. No.
But I have dated patients.
Oh really?
Oh,
Yeah.
what?
Yeah, two.
Really?
Yeah.
You're
How
like,
is
I
that
love your
interesting or
smile.
what?
Well, they were both cute. My age from Fort Worth.
That's awesome.
One of them got my name off my diploma in my op. And I literally sat there. He was in the chair putting me in Facebook, like my name off my diploma. And he didn't know I was back there watching him, but he was adding me on Facebook. So
Wait
when
a
I went
minute.
back to the break room, I could see
That's bold.
like, added you on
Yeah.
Facebook. He was cute. So I was like, okay, fine.
Wow.
Interesting.
The other one, my other hygienist set me up. He was not a patient in the office.
Okay.
And he came in as a patient and saw me. He was cute too, so it was fine.
Awesome.
But
dang, you never know.
but they were not
you never
inappropriate
know.
to me in the chair. So
Respectful.
yeah.
With nice teeth.
Yeah.
Well, I don't see you dating somebody who would be disrespectful.
No,
to you
definitely
anyway,
not.
So
Yeah.
there you
Mm-mm.
go.
We don't deal with
So
that.
do you clean Trevor's teeth?
Oh yeah, at home.
Is he like ready, or is he like again?
No, he asked me to.
Oh, he
He gets
does?
excited. Yeah.
Good.
He's super clean.
Yeah, that's
He
good.
has like certain soaps for certain things, and yeah, he's super clean. So he likes it when I clean his teeth.
yeah. Good.
It'll be like a week, and I'm like, "There's nothing to clean yet. You're fine." And he has the cleanest teeth.
That's awesome.
I would be doing the same thing.
I would too,
like,
for sure.
get over here, clean these babies.
I think about this all the time. Like if I was like dating a chiropractor, like I would have you pop my
Oh,
butt
yeah.
on my neck all the time. Like things like that. Like things you would do so much more of certain activities
Mhm.
if like you just were immersed in it all the time, you know?
Mm-hmm.
That's funny.
Too bad he's not a massage therapist because my shoulders need that. After work, good lord, my shoulders
Me
hurt.
too, girl.
Yeah. It's okay. He can send you to one.
He rubs my feet, so it's
There
fine.
you go. Oh my
I
gosh.
love that.
What else have patients said?
Like the most out there thing.
That was probably the most appalling.
yeah, that's
but-
bold.
When patients are on nitrous
Oh,
and you lay
yeah.
them back in that chair and that nitrous gets going, they will tell you their family's whole life story, their family's skeletons in the closet. I mean, they just start
They
going.
count rounding
Not even on
numbers.
nitrous, but it's like you lay someone back and they feel like vulnerable and they just start talking.
Yeah, so you're like a therapist.
Oh yeah. So I've heard some
and a hygienist.
like crazy family stories.
God, remind me to never get on that nitrous.
But-
Actually, I think I tried it once and
Yeah.
I hated it. It made me feel like I was suffocating.
Yeah. I don't like it either for me.
I don't think I've ever
but-
had that.
People love that stuff. But yeah, they start talking. It's funny.
Wow.
They'll tell you their dating stories, their all of it.
And are you just like, yes, this makes my day go by, or are you like, I didn't need to know that.
Sometimes it's things that I'm like, yeah, let's turn the gas down a little bit. And then sometimes it's things that I'm like, tell me more. Like,
Yeah.
I want to know more.
Like, this is interesting.
Yeah, if you're going to tell me, I'm going to ask questions.
That's
But-
funny.
It's back to I can read my patients. So the ones
Yeah.
that I know now who I see them every 6 months. So I know who I can talk to and joke with and the ones that I
Yeah.
can't. So that, yeah, the ones that I can joke with, I'll be asking questions,
That's awesome.
laughing and joking. And
Yeah. Oh my gosh.
Do some of them you like actually kind of get to know really well over the
Oh,
years?
yeah.
Like when, yeah.
I was in a practice for like
Cool.
5 years and I was friends with a lot of those patients outside of the practice too, like the younger ones that were my age.
Mm-hmm.
Because at that point in my life, I was young and single, playing kickball. And so they'd come in and like tell me their dating horror stories that they were going through too.
Oh, geez.
Yeah, and I'd be like, oh, well, join our kickball team. Like, what else do you want to do around
Yeah.
Fort Worth? But,
It's kind of like being a hairstylist, I feel like. Hairstylists
Oh, yeah.
are
oh yeah,
therapists and everything.
Oh yeah, my
in
girl Brittany knows my whole life story,
Yeah.
the ups and downs.
And everything in between.
Oh yeah.
I go to Kaylee.
Nuh-uh.
And so
Oh,
every time she
another
does my hair,
another
it's like
friend connection.
Oh my
it's a
gosh.
therapy
I'm like, I don't
session
know
in
Kayla.
there, man.
Is
she's
that-
a,
love
she's
it,
a good
though.
therapist.
Oh,
Yeah,
yeah.
they are.
She's great.
Hairstylists are great.
Yeah.
But see, this is one of those realization moments. Like, I don't have that BFF. Like, okay, this is embarrassing to say, but I don't have like a consistent hygienist. I have a problem. I need to fix this.
Yeah, I don't either.
I'm gonna make an appointment. We're
I'm not
start
going to
over.
lie to you. So when I was in college and stuff, I don't know what, like, when you're in college, life is just so busy.
Oh,
Like,
yeah.
I never
Oh, yeah.
even thought about
Going to the dentist.
going to the
I'm the
dentist.
same.
And then, like, recently, probably, I mean, it must have been a year after college, y'all. I'm not kidding. I'm like sitting there and I'm like, I have not been
In years.
to the dentist in years.
Yeah,
No, that happens all the
So I'm
time.
like,
that happened.
College
like,
kids.
what?
Because they're home and then they're not. They
Yeah.
leave.
Yeah.
And then usually it's their parents make them go when they finally graduate and come back, or they finally get on their own insurance and they're
Yes.
paying for it. But they're like, okay, fine, I'll use my insurance.
Yeah.
Because now you're the one paying for it, right?
Yes.
But that happens all the time.
Yeah.
But usually that age group is young and healthy, so it's pretty easy to get back
Right.
on track.
That's good.
But
That's
man,
it.
now I'm like,
Yeah.
I'm great with my
25,
kids'
like-
appointments, but I'm not as good with mine. So
But then,
Yeah.
like, for not having a consistent hygienist, like if you go normally, people will always say, well, I see somebody different. Some places don't have like a set hygienist.
Oh, okay.
Yeah,
True.
like a temporary hygienist.
Your office is, they just choose
So we
to do
have
that.
2 hygienists in my office now. So we try and keep patients on the same schedules. So
Okay.
usually I see the same patients, and then my other hygienist will too.
Mhm.
But like if you reschedule and our schedule's tight or something like that, if you don't request one of us, then you might be put on their schedule.
Got it.
But
Okay. That makes
or
sense.
some it might be a lot of turnover. I don't know, different things.
Yeah. Okay.
But I temp too, so I go to random offices and temp and fill in.
Oh, really?
So I'll see some patients that are like, "Let me see you again next time," and I'm like,
You
"I won't
know?
be here."
Yeah. How often do you do that?
Once a week.
Nice.
Mm-hmm.
Is that just
Extra
is that
money,
volunteer?
honey.
Okay, there you go.
Wait, do what?
She temps.
So
just
there's
leaves
it's
it.
called temping for hygienists. So it's like
Oh.
subbing for teachers.
Oh, okay.
So like if someone calls in sick or like they're on vacation, they'll
But
call.
how does that work with your job? Like, if
There's
you-
an agency in DFW.
Oh, okay.
The dentist will call the agency, and then the agency hires us. So they'll send me like 5 offices that need help, and so
So-
I get to pick like which one I go to.
Oh, okay, so you go on agency, like
Mhm.
some hospital staff are.
I feel like
Yeah.
it's like a
agency
travel
too.
anesthesiologist.
Yeah,
or
kind of.
something, Like,
Yeah.
hey, I'm gonna be here, except for it's like
Yeah.
one day. Bye.
Yeah.
But yeah, okay.
Because what's your normal schedule? Is it 5 days a week where you're at?
So
or no?
usually it's 4, which
Okay.
is considered full time for a hygienist. But we're off every other Monday or Friday.
Oh, okay.
So on my off days to make more money. So if I have something going on, I won't temp. But
Yeah.
I like money. I like nice things and traveling and doing
Yeah.
Yeah,
all of that. So
don't blame you.
if I'm free on a Monday and not working, I'll go
Yeah.
find somewhere to work.
Is the pay better when you're temping?
Yes.
Okay.
It's about $5 more an hour.
Nice.
Wow.
Okay.
Which, speaking of, by the way, a lot of hygienists are hourly. Actually,
Really?
most of us are.
Really?
Okay.
And so some dentists won't pay their hygienist
Mhm.
when someone cancels.
Whoa.
So don't cancel last minute on your hygienist because they're not all paid for that
Oh.
hour they're sitting there and not seeing somebody.
Really?
That's
Yeah.
awful. I feel like that's not your fault.
No.
No.
I don't work places like that, but there
But-
I've heard a lot of my friends that work in offices that if their patient cancels last minute, they don't get paid. And it's a full hour. I mean, that's a good
And I'm sure you're
$50.
still like doing
Crazy.
things during.
Oh
that
yeah,
hour,
you're still
to
like
get ready
restocking
for
your
the-
room, doing notes.
Oh my gosh.
That's one of my interview questions I ask when I'm interviewing with doctors. Do you pay when patients cancel?
Yeah.
God, I'd be asking that in everyone.
Yeah.
Okay.
Isn't that kind of like flight attendants? Do
I
they
don't know.
like don't
Like
they
if their
only
flight
get
gets
paid when
canceled?
they're in the air?
I think that's changing.
Oh, okay. Because I'm like,
I think that's how it used to be, but now they've been kind of fighting back and being like, no, it's not cool.
Because like weather. I mean, if you ended up
Yeah.
getting stuck, not taking off for 3
Yeah.
hours, then
Yeah.
it's like it's a waste of my
You're
time.
still working.
Mhm.
Yeah.
You're still doing things for the office. And
That's crazy.
so don't cancel last minute on your hygienist.
Always call ahead.
If it's
24
like
hours.
if it's like a day in advance, whatever, they have time to fill that spot for the hygienist, but like 30 minutes before,
Yeah.
don't be that person, man.
Or
Come
next
on.
time you show up, bring them a $50 gift card.
Yeah. Well, then they also won't charge like for no-show fees.
Really?
Yeah. So then people will just like not show up. And I'm like, at least charge like $20.
Yeah.
At least
If
pay
they
your
charge-
hygienist. Yeah.
If they charge a no-show fee, then they'd have a way to pay you.
yeah, to
for
pay the
your hour.
hygienist. Yeah, I don't work in any offices like that, but
Wow. That's crazy.
yeah, so don't cancel on your girl last minute.
Yeah.
Not very nice.
Okay, so you said something earlier that there's not very many males in dental
Mm-mm.
hygiene. Really? Like how
Not
many were in
many.
your program?
I had
Homeschooling.
0 in my class.
Wow.
So there's 30 of us in a class. The class above me had 3, weird enough. But they'll
Okay.
go years without having a male hygienist. But then like a lot of male hygienists that are in school for that will go straight to dental school or
Okay.
different things. But
Like they want to be a full
Mhm.
line dentist. Okay.
I really feel like I've never had a male
yeah,
hygienist ever
I've had-
in my life.
Like I have a male dentist.
Yeah.
here
Yeah,
in town.
that's super
Does,
common.
but
Yeah.
hygienist?
Yeah, it's
I
not as
don't think
common.
I've
Kind of like
ever-
nursing though, you know?
Yeah.
You don't see many male
As
nurses.
many, yeah, for sure.
The whole medical like industry in general.
Except for
just-
ours.
What?
Oh yeah, y'all are male
Med
dominated.
device.
Oh yeah.
Yeah. Yeah. That's interesting.
Get in there
I
and
didn't
show them how it's done.
Oh yeah.
Well, it's
It's
always
fun.
like
I learned so much from them though, but I do like there is. I think it's starting to evolve a little bit more in our industry. Like there are definitely more females now. in our
Definitely.
industry, but it's still like it's pretty.
Well, and like for hygienists, we're so type A OCD. Like most guys aren't.
That's true.
That's not their personality to be type A OCD.
Yeah. Males will be in there doing a cleaning like,
yeah,
you're good enough.
Yeah.
I got enough.
Whereas
tartar
me, I'm like,
off.
okay, it's gone.
Good enough.
Just make sure one more time.
Yeah.
So it's just not very.
Yeah.
Yeah.
Oh, that makes sense. That's
Yeah.
funny. Sorry, men. I love all the men in my life, but it's true.
I do love me some men.
I do love me some men.
Still love y'all, but oh gosh.
My man's is the best.
Mm-hmm. Aw.
We already kind of asked you what you're most
Oh,
looking
yeah.
forward to, but
What is your strategy if somebody's like terrified, or if you had a kid come into your chair? Like, what is one of your strategies for like calming them down or distracting them or like comforting them to get them to?
Thankfully, I don't see a lot of kids. Like if we have a kid who is that terrified, we refer them out because we don't have the distractions like in an adult practice. If you go in a pediatric office, they haven't made. They have video games, they have TVs, they have all of it. We don't have that.
True.
So usually if they're too freaked out, we'll send them out to a pediatric office. Now my adults that are scared.
Are there a lot of adults that are scared?
Yeah.
What?
A lot
'Cause the
won't admit
sounds,
it.
or what?
Yeah. Usually it's like the drilling sounds or whatever. And once they see me a few times, no, I'm not going to hurt them. So it's fine. Like when it's their first time seeing me, they're always like, no, who are you?
Yeah. Don't.
But usually, I mean, like some it's comedy, some it's like making jokes that calms them down.
Yeah.
Some it's,
Which you're so good at.
yeah, that's my favorite. That's really easy to get past. Some though, it's like you can't joke. It makes them more nervous. So yeah, back to reading the room. You have to know how to calm them down. Some want a full therapy session. Some I'm like, let's try the gas.
Let's try the yeah.
But
Wow.
most of the time for me, it's humor.
Yeah.
I can joke my way out of a lot of things.
You sure can.
So-
That's your personality.
Yeah.
It's awesome. Oh my gosh.
That's just easiest for me. But
Yeah.
then you have the old lady who doesn't think it's funny.
And she's like,
Oh god.
then I'm kind of screwed. But
That's always so awkward when you say something and you think it's going to be so
you
funny.
think
Oh,
it's
I know.
gonna
Yep.
deliver well and be a hit, and it's like,
And the person doesn't take it the same way.
Mhm.
That happens to me a lot because I'm just
too.
like matter of fact. Like I'm just
I can
matter
see
of
that.
fact and like I
yeah.
say what's on my mind and some people are like, I'm like, what? I'm an open book. I don't care.
Yeah,
it's
same.
funny.
It is funny. Yeah. Oh my gosh.
But
That's
anyway, I'm sure you get that too.
Mhm.
So, what are you most looking forward to, like in the future in dental hygiene? That's the
Oh, I'm pumped for the AI stuff I was telling you about
Mhm.
because that you can show patients. Like
What is your pet? Like, what are your pet peeves?
pet peeves? I think I hinted on it earlier, but do not bring your coffee to your appointment.
Yeah. Okay.
Don't do that.
That's it.
I don't care how early it is. I don't care. Get it afterwards. Leave it in your car. I can smell it and I don't like it.
Good.
You don't
Well-
want to smell coffee breath on anybody else. I don't want to smell it on you.
No, I don't want to.
Drives me insane.
Yeah.
Well, and then what do people think? They're just going to walk out drinking that? You're not supposed to drink anything.
People will
for-
drink it in between me cleaning their teeth and the dentist coming in.
Ew, that would taste disgusting.
Disrespect.
It's like brushing your teeth and then drinking a glass of orange
And
juice.
That's straight up
You literally just
disrespect.
got your
I'm like,
teeth
come
cleaned.
on, man. Like, I know you're going to leave and go to Starbucks, but at least give me the
At least don't tell
gratification
me.
of
Yeah.
leaving the
Yeah.
office and then doing that.
That's funny.
What else? Oh, people will take their shoes off in the dental chair. There's no need.
Hold on, man.
No
Let me
need.
kick back.
You're here
Ew.
for 45 minutes. Okay, if you're there all day for a long treatment, whatever. Do what you want. For the 45
not
minutes you see me,
whatever.
I don't want to see your crunchy dogs, man. Like, I'm out. I'm out.
Ew.
That people
Ugh.
telling me, oh, we're not going to do that today. Same thing. Back to your doctor. You're not going to tell your doctor you're not going to do something today. Like, I'm not going to do something that. Yeah.
I'm sorry, but like,
Or people will literally say, like, we're not gonna clean that tooth.
That one.
wait, excuse
I
me.
just don't
Okay.
want you. Don't touch
Okay, man.
this one right here.
Let's try.
Do you ask why?
Oh yeah. And usually it's like, oh, that's my one sensitive tooth or something. But there's so many things that we don't charge for. I can put on that one sensitive tooth to make it not sensitive without like a shot. Like if you're cold sensitive, we have stuff that we just brush on there that it will last like 30 minutes so I can clean it.
Yeah.
Oh, well,
But people come in,
But
oh,
see, this is
we're not
like,
doing that. We're not doing this. And I'm like, do you go to your doctor and tell them that?
That is so
Or they're rude to me because I'm the hygienist, not the doctor.
oh yeah. Hmm.
I have a bachelor's degree. I worked my ass off.
Yeah.
I've been a hygienist for 8 years now. I think I know a little something about what they're going to tell you.
Yeah. Oh my gosh.
That's crazy. It's just like nurses. It's just, I don't know. I always treat people with respect no matter where you stand
if you're
on
the CEO,
rung, but
janitor.
some
Like,
people just don't know how
matter.
to do that.
Yeah.
Or people
It's
don't
really
know either
disappointing.
that I cannot diagnose decay. So they'll come in and sit down, and like the second I'm done with x-rays, they're like, where are my cavities? I can tell you I see like some fishy spots, but I can't tell you. It may be the most obvious cavity on the x-ray I've ever seen in my life, but I can't diagnose it because I'm not your doctor.
Yeah, that's like you asking.
So there's patients that'll ask 8 times, well, how many cavities? How many cavities? And I'm like, he'll be in here in a few minutes. He'll tell you.
It's the same thing like you have an x-ray tech, but your doctor
broken?
tells you.
They know.
They know, but like
Yeah.
you can't say that.
like, am I pregnant? You know what? Your doctor will be right in. We'll talk.
Yeah.
It's like, yeah. Okay.
What else?
How do they respond?
Oh, also, guys, people need to know for any appointment, you're allowed to use the restroom while you're sitting in the waiting room.
Oh my gosh.
Oh yeah.
Okay.
Why are they scared? Why are they scared?
I think some people are socially awkward and they like don't want to get up in front of people.
I
So
don't
if
get it.
you owned a practice, what would be
Oh,
your
boy.
approach?
Well, have you been to the restaurant Dick's Last Resort?
I have.
Yeah.
If I owned a practice, that's what it would be like. There would be
Walk me
signs.
through this.
There would be sarcastic signs all over the office. Like there would be stuff like I say, right when you
Oh my
walk in the
gosh.
waiting room, there's going to be a sign that says, "Go brush your teeth." If you haven't brushed your teeth, and then there's going to be a sign that says, "You are allowed to pee while you are sitting in the waiting room waiting for your appointment."
Yeah.
When you walk back
But
into
like more
oh yeah,
rough and tough and
oh
straight
yeah,
to the point.
straight to the point. No
Blunt.
sugarcoating it. Like in my hygiene rooms, there would be a sign that says, "Not flossing is like not wiping your crack after you do the deed. Like clean it all, you know."
I'm
It would be
sorry.
savage.
That's awesome.
But it would be savage.
But these are these things that you just have to.
well, and patients like to be babied.
Yeah, that's true.
And so you
Okay,
have
wait,
to
back to the
play the
bathroom thing
role.
because I actually feel like I've done that before.
You've
but-
done what before?
waited until they called
Waited
it back.
until they called me back.
Okay.
But I think it's because sometimes there's no bathroom like in the waiting area, so
Yeah.
it's like behind the door. So then you
Yeah.
feel like, well, they haven't called me back yet, so I don't have access to it.
You can go pee.
So,
Please go pee. Don't waste my time.
but I've definitely done that before.
Now, I will say, like, if I
That's
wasn't
funny.
in the industry or like in medical, I would think the same way.
Yeah,
Like, I remember when
like,
I was like
yeah.
a little high schooler, I'd be like, "Can I go pee or not?" I'm here to tell you, you can.
It's like, please, I don't
Go
get a
for
lunch
it.
break. Let me get a
Yeah.
lunch break.
Good to
Especially when
know.
I'm already like 15 minutes
Behind,
late,
yeah.
and then I go get them, and they're like, "Oh, let me pee," and then they're in there brushing their teeth, peeing, and now I'm 30 minutes late.
Great.
Yeah. Y'all,
I'm
you
supposed
are
to be out at 30.
allowed
We'll
to
work till 5.
pee.
Yeah,
Go
there you
for
go.
it.
Oh my gosh.
Send
that's
it.
funny. Send it.
Send. Full send.
Oh my
buddy.
God. That's funny. Okay. Let me think. What is your favorite part about impacting people's oral health?
Well, I love that I work with a smile. Like people will be
Aw.
not confident about their smile.
Yeah.
And then when you are, it changes your whole outlook on life. Like
Yeah.
a smile is everything. You see someone, the first thing you see is their smile.
Oh yeah.
It's true.
So like especially our like hardcore Invisalign patients. Like I love working with them at the end. They're so much more confident. You can see it. Or like patients that haven't had a cleaning in forever and we get their gums in check. You can just tell.
Mhm.
So I love like being a part of someone's everyday first impression.
That's awesome.
Like,
love
I feel like
that.
keeping that healthy is a big thing for people.
Yeah.
it's true.
That's
Yeah.
amazing.
I feel like I'm gonna sing that song.
And you-
And she'll leave you with a smile.
That should be my theme song.
Oh, we can play that. We'll put that as like the title. What is that on Annie? Is that the movie?
No.
What?
That's
Do you know
a
what I'm
country
talking
song.
about?
It's a country song.
Oh.
I've seen I've seen Annie so many times. What
You
are
know.
you talking about?
Oh my God. When she's like show dancing. Do you know what I'm talking about?
Like
Wait
the
a
redhead
second.
curly Annie?
Yes, I've seen that movie 10,000 times.
Yeah, the curly head.
Yeah.
Yeah.
And she, they're like
That's a
mopping
hard
the
knock
floor.
life.
Oh, yeah. And she'll leave you with a smile. You know what I'm talking about?
I don't remember that part of the song.
You know what? We are gonna.
It's the Hard Knock Life for us.
Life.
I love that movie.
It is. It's really cute. But I'm pretty sure it's in there, and we're going to clip it in so that everybody knows that I'm not crazy.
So senator, so janitor, so long for a while. Remember, you're never fully dressed without a smile.
Okay, well,
what else, man?
Well,
we weren't vibing on that song. I wasn't picking up what you were putting down, but apologies. Okay.
What else do y'all want to know? The dental world. Is that it?
I feel like we've gone through a lot here. It's been like very interesting.
If you could give 1 or 5, whichever, just tips and tricks, one thing to help impact people, main takeaways for oral health.
At least brush your teeth twice a day. My mom used to always say, you brush in the morning to keep your friends and at night to keep your teeth.
Mm-hmm.
At least brush your teeth twice a day.
Okay.
That's the easiest thing. It's not hard.
Mm-hmm.
Okay. Yeah, seriously, brush your teeth at night. I feel like I don't know how people
night
go
is
to
so
bed
important.
with that. I've done it before. I've fallen asleep, but I feel
no,
so
night
gross
is so
in the
important
morning.
because everything's just like sitting there and caking on your teeth all night. You got sugar bugs crawling around there.
Yeah.
Get it off.
I like that analogy, though. Your
No,
mom
please
says
floss.
Yeah.
Do all the fun things too. But if you're going to do nothing, please brush twice a day. And see your hygienist every 6 months.
Well, Kelsey, it's been really interesting getting to talk with you more and getting to know more about what you do for work and all your
Yeah.
little tips and tricks and a lot of things that I didn't know about the dental industry at all. And now I need to go brush my teeth and use mouthwash and floss. I will be flossing on the way home. But we really appreciate it. Do you have any other closing remarks or
No,
anything you'd like
I've had
to
fun with
say?
y'all.
It's been so fun.
Yeah,
Thank
I
you so
appreciate y'all
much for
having me
joining
on.
us.
If y'all have any questions, you have my number.
Yeah,
I can answer them.
for sure.
Yeah.
Brush your teeth, people, and floss.
And thanks for watching.
We'll see you on the next one.
In the brand new